When you have a grade 4 brain tumour removed, there are two things doctors can tell you with certainty. First, it will come back. Second, it will probably kill you. But now, a remarkable new treatment boosting the body's immune system to fight the cancer is having promising results. Glenn Connolly explains.
She had a brain cancer. It was really bad, but it's grown back now and it's even worse. So we want to get it gone forever.
Just had a routine scan and we were really blindsided actually. I really wasn't expecting, it to come back. I went straight into surgery the following week and had it removed, and then we got the very bad news that it was a grade 4 glioblastoma, which is the most aggressive form of brain cancer.
In late 2012, Kate McRae was told she wouldn't see 2015 after having a tumour removed from her brain for the second time.
They give you what they call an outlook, which is essentially how much time they think you've got until, eventually the tumour will regrow and...
How long was that?
Well, I think at that point it was probably maybe 2 years.
Look at Kate now. The 44-year-old mother of 4 beautiful kids is a picture of health and loving life.
As an Australian male, I kind of tried to get the toolbox out and fix things, but you can't do it directly. So it's a lot of asking for advice and doing some research.
The McRaes refused to follow the conventional path for dealing with grade 4 brain tumours, which is to sit tight and wait for the cancer to return. Kate's husband Simon discovered a clinic in Germany performing a remarkable new therapy, achieving extraordinary results for patients like Kate. But dendritic immunotherapy, as it's known, is expensive and time-consuming, all up around $100,000.
Mum's got a brain tumour, which is a form of cancer.
Family friends set up a fundraising drive, which included this incredible video starring the incredible McRae kids, Max, Hudson, Evie and Chella.
I'm Evie. I'm Chella. And we're twins. Thank you very, very, very much for money, so Mum can sometimes go to the Germany hospital.
Once they had the money, the next step was to pack up the family of 6 and jet off to Duderstadt, Germany.
The gift of it was hope. There was hope. All of a sudden we had hope. And that was a really different feeling to what we'd been feeling for 6 months prior to that.
Here's how the therapy works. First, white blood cells are harvested from a patient, a fairly short procedure, not unlike a blood transfusion. Naturally occurring dendritic cells are identified and boosted with an anti-cancer agent, like a tiny dose of chemotherapy. Those boosted cells are injected back into the body where they get to work, recruiting more healthy cells and attacking the cancer cells left behind after the removal of the tumour.
Having obviously gone through the radiation and the chemo here, the actual treatment over there is just like a walk in the park. It's so easy compared to what I'd already gone through here.
There's no doubt this kind of treatment is the future for dealing with cancers like brain tumours. Already some of our great minds are working on it here in Australia right now. But the frustrating thing for patients is that while a version of the treatment is available in Germany and Norway, it's unlikely to be available here for at least a couple of years.
I'd like to be part of my child's life, I want to be a dad and I want to experience that with Estelle.
Mark Sullivan is exactly where Kate McRae was 2 years ago. After having 2 tumours removed, doctors here have told him there's nothing they can do, and nothing he can do except wait and hope. And just like Kate, he's motivated to fight by family, the unborn child being carried by wife Estelle.
Ideally, I would have loved to do it before the baby comes, but it's just the fact we just don't have the money to do it.
Mark and Estelle are trying to raise money for their trip to Germany, but with Mark unable to do his construction job after the cancer damaged his eyesight and Estelle heavily pregnant, only the generosity of others will get them to Duderstadt.
Oh, look, I think the early data out of dendritic cell vaccination studies is very encouraging.
Professor Derek Hart of the ANZAC Research Institute is leading the Australian research into dendritic immunotherapy. The long-term benefit means our treatment, when it becomes available, will be better than the Germans.
It's given us, you know, a normal life, an opportunity just to be a normal family.
To be fair, there's nothing normal about this family. All 6 of them are truly extraordinary.
And the good thing, Mum will get better.